everybody to our first KDHS COVID on the couch. Susan and I are here today. We just thought that we'd have a bit of a chat about our COVID-19 response to date and potentially probably some key things and key messages we thought we'd give back to staff. So this is a bit different to our normal memo.
And can you go back and tell us where this all started and I guess why Kyabram are making the decisions that we've been making?
I actually went to a regional CEOs meeting, and one of the CEOs there was actually explaining what was actually happening over in Italy. Is he had a friend who was working as a doctor over there, and Susan, the stories that he was conveying were really quite frightening about what was happening in northern Italy, and it really resonated with us as CEOs because we could actually see the impact it would have here in Australia and our region and our towns like Kyabram if that sort of environment continued from Italy. He was using things like we need to plan for 200% occupancy in our hospitals with about 40% less staff. And I just sat there thinking, how would Kyabram District Health Service cope with an extra sort of double our 100% capacity with roughly about half our staff, and that probably really concerned me. And obviously I came back then and thought we really need to do some consolidated planning and make some very definitive decisions probably from that particular day.
And we've definitely done that. We've had lots of changes that we've put in place, and I know that we've certainly been following a bit of a regional lead as well, so looking to what everybody else in the region's been doing and trying to do.
Absolutely. So, you know, even the decisions to stop doing services such as social support group and cancelling theatre, closing our cafe, minimising visitors and temperature checks at the front door. So every one of those decisions has been made based on research, what's happening in the state, but more so what we're actually doing as a region. So those decisions haven't been made lightly, and some of them we understand have had impacts for staff. But I think at the end of the day, safety of the staff has been the reason why we've made those decisions, because obviously our workforce is so important and we need to be protecting them. And also being strong advocates and messages to our community, I think, was the other reason why we felt as a region, and even here as an exec team, why we actually needed to be quite decisive in our current decision making. So Susan, one of the things, when we talked about staying at home, one of the probably things that we've enacted, or one of our decisions, was to maximise as many people as possible to actually work from home. And I know you're one person who's been able to trial that. So do you want to talk through what's that been like? Yeah.
Well, it's certainly challenging. And I guess the important thing to note is we've really tried to consider who and how many people can work at home. I know Bendigo Health, for example, has got 300 staff working at home, and that all happened pretty quickly. Obviously, being in a smaller health facilities, we just don't have the amount of roles that actually can work at home. I think that that's really, really important for us. But personally, it's challenging. I'm certainly really productive at home.
If you're talking about it's safe to work at home, or we're promoting to work to home, do you feel it's safe for staff to come to work?
And look, it's probably a question that we're getting asked quite a bit. We're a health service. We actually deal with infectious patients all the time. We have the equipment, so we have PPE equipment. We are trained in how to wash our hands, and I think that's becoming a communal thing now, but certainly we've had that training and we've had that knowledge for a long time. Helen does do, walk-arounds and has a look and scores everyone to see if they are actually doing it right. So we know how to do infection control well in health services. We're doing everything we can to minimise the risk for our staff. There's additional training out there for people. We've got more training around donning and doffing. We're probably safer here, some would say, than what we are in actually going to the supermarket.
And is that why we're also promoting to have flu vaccinations, like that's gone out?
Yeah, so flu vax are out, and thank you. I think as of yesterday we had about half of our staff vaccinated. We had nearly 150 staff vaccinated by yesterday, and obviously that will increase over the coming days. So thanks to everyone that's done that, and to the team that are actually doing the immunisations. But yeah, so yeah, we're doing everything we can to minimise the risk. If people have got concerns, speak to your managers, come and speak to one of the directors, and we can work through with you your specific concerns and what that. We've got enough PPE, and are we using it appropriately?
Statewide now, there's a centralised ordering system that's supported by the Department of Health and Human Services, because obviously it's an area that we need to make sure that we have enough of. And that was also one of the reasons why our theatre ceased when it did, is obviously they're a big consumer of PPE, and we wanted to make sure that our other services had enough. So, and I'm confident we have the processes internally to manage it, because obviously our expectation is we'll need more of it. And actually, pleasingly, just before Danielle sent us an email to say that we had a huge arrival of some PPE, which not everything we asked for, but the majority of it, which is absolutely fantastic, because it is important. It is about protecting our workforce, and it is about people understanding when they need to use PPE. So there's some new guidance. So I encourage people to make sure you know how to use our prompt system for policies, and also our intranet. There is mandatory education that everybody needs to complete. Use your expert infection control. You'll have leaders in those areas that can guide if you don't know how to use something, if you think you don't know how to don or doff, for example. In a nutshell, it's important that we have the equipment available for protection for staff. We're keeping up to date with the guidelines, so you need to make sure that you can access the most available guidelines through our prompt system as well. So Susan, one of the things I think it'd be worth asking is, can I cancel leave if I've got leave pending?
We need to be considering this on an operational basis. So there probably isn't a straightforward answer, and we need to be having a look in each department and what's happening at the time, because we want to be able to have our staff available when we need them. We're looking at things like people having single day leave at the moment. We're kind of in this lag waiting.
Yeah.
So single day leave would be great. Or maybe approving leave for 4 weeks, but not anything past that. Or maybe cancelling leave for certain periods of time. We're also noticing a big drop in our acute patient numbers.
Mm-hmm.
So, you know, to cancel leave and then have the staff, we actually don't have roles for everyone. So we're really trying to walk that fine line each week, balancing what's our staffing numbers, what's our patient numbers, what do we actually need. If you've got questions, speak directly to your managers. The exec are trying to meet together and make some consistent decisions, so that what we're doing is trying to be as fair as possible.
Mm-hmm.
But again, it's about 200% occupancy, 40% less staff. How do we cover that?
It's hard feeling disconnected from the staff, like you like to sort of have a presence and wander around the organisation, say hello, and so in that regard you feel quite personal. Hopefully you'll have a relaxing Easter. We know that you'll be at home, but we're very grateful, and I know our board of directors have acknowledged that via a memo, but they're in touch with me all the time, and they very much want to express their gratitude, of which we as an exec team, and I know we as a whole team here at KUHS are working through this together, and we appreciate everything you do.